Imagine hearing a sudden thud in the next room. You rush in and find your mother sitting on the floor, confused. One side of her face has gone still. Her words are tangled. Her arm won't lift the way she wants it to. In that moment, panic rises. But knowledge is what turns panic into action. In the first part of this series, we explored how a stroke begins, why brain cells start dying within minutes, how symptoms appear suddenly, and why recognizing signs like fast can save someone's life. We also understood the two major types of stroke, one caused by a clot, the other by bleeding, and how each can affect different parts of the brain in unique and unpredictable ways. Today, in part 2, we move one step deeper. We'll look at what happens after those first terrifying moments, how hospitals treat a stroke, how doctors decide between clot busting and clot removal procedures, how the brain begins healing, and what rehabilitation really looks like. Finally, we'll talk about the most important chapter of all, how to prevent a stroke from ever happening again. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP-UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. When someone is having a stroke, every second counts. The decision you make in the very first minute could define the next decade of that person's life. That's why the first step is always the same. Call an ambulance. Never drive the person yourself, because stroke treatment begins on the way, not after arrival. At the hospital, the race continues. A brain scan is organized immediately, because treatment depends entirely on whether the stroke is caused by a clot or a bleed. It is one of the few medical emergencies where two patients with the same symptoms may need completely opposite treatments. Let's now see what happens if the scan confirms a clot, the most common type of stroke. For people who reach the hospital within 4.5 hours, doctors use a clot-busting medicine such as alteplase or tenecteplase. This treatment, called thrombolysis, works like melting ice. It dissolves the clot from inside the blocked artery, allowing blood to flow again. If given early enough, brain cells that were dying can survive, and the person may recover dramatically. But sometimes the clot is large, stuck in one of the main arteries feeding the front part of the brain. In such cases, doctors may take an additional step, a procedure called thrombectomy. Through a tiny tube inserted from the groin, specialists travel all the way into the brain and physically remove the clot. The entire journey happens inside the blood vessels, almost like retrieving a stuck seed through a narrow pipe. This is one of the most advanced stroke treatments today, and when done within the right window, often within 6 hours, it can completely change a person's recovery. Now let's move to what happens right after this early treatment. Doctors create a personalized plan based on the severity of the stroke, the cause, and the patient's medical history. This plan often includes antiplatelet medicines to prevent new clots from forming, especially in ischemic strokes. Aspirin is used early and later switched to clopidogrel for long-term protection. Blood pressure is carefully controlled, especially in strokes caused by bleeding. In hemorrhagic strokes, the goal is to reduce blood pressure quickly and safely, because high pressure increases the risk of the bleeding worsening. And for people who cannot swallow safely, a feeding tube is used until the swallowing reflex improves. This may feel overwhelming, but it is essential for safety and healing. Doctors also start early mobilization, helping patients sit up, stand, and eventually walk, because lying in bed too long increases the risk of blood clots in the legs and slows recovery. If the patient has atrial fibrillation, anticoagulant medicines are introduced later to prevent future clots from forming in the heart. If there is significant narrowing of the carotid arteries, surgery may be recommended to remove the atheroma buildup, and if the stroke was caused by a burst artery, such as in a subarachnoid hemorrhage, special operations may be done to secure the leaking vessel. But one of the most important chapters begins after the emergency has passed: rehabilitation. Rehabilitation is where life is rebuilt, where the brain slowly rewires itself, creating new pathways, where a paralyzed hand starts to move again, where words begin to return, where balance improves, where confidence grows. This journey involves physiotherapists, speech therapists, occupational therapists, dietitians, psychologists, specialist nurses, and doctors, all working together. Recovery can take weeks, months, or sometimes longer. But with the right therapy, the brain surprises us with how much it can heal. Finally, let's talk about prevention. Because a stroke is not just something that happens once. The risk of a second stroke is highest in the days and weeks after the first one. That's why controlling risk factors becomes crucial. Stopping smoking, managing blood pressure, lowering cholesterol, keeping diabetes under control, staying active, eating a balanced diet, keeping alcohol within safe limits, using anticoagulants in conditions like atrial fibrillation. These are not just lifestyle changes, they are life-saving decisions. Stroke prevention is not complicated, but it requires consistency. A small change today can prevent a life-changing event tomorrow. As we close part 2, remember this: stroke treatment is a race against time, but recovery is a marathon of hope, effort, and resilience. And prevention is a daily promise you make to your future self. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.